If you suffer from severe heartburn, acid reflux, or GERD, there are other options available besides medication. And here to talk to us about the LINX implant is Dr. John Hartman with Genesis Medical Center. Doctor, thanks so much for taking the time to talk to us today.
Thanks for having me.
Okay, so what is this LINX procedure and how long has it been around?
So it was FDA approved in 2012. And it is a procedure where we place a ring of magnets around the esophagus, and it looks like this. And the magnetic field is broken when someone swallows, and it lets food go through. And then once the food goes through, it tightens back up to prevent reflux.
So when would someone know if they are a good candidate for this implant?
Sure. So anyone who's having reflux can get an appointment at our clinic and come in and see us. We'd evaluate them, and then there's a series of tests we do to determine if they're a candidate or not.
Okay, so Dr. Hartman, you're only one of 5 surgeons in the entire state of Iowa that does this surgery. How long have you been performing this procedure?
Since October.
Since October, so not very long. How many procedures have been done so far?
So we've done 3 so far, and we've had great outcomes with all 3 of them.
Okay, but that's just here, right?
That's correct.
Okay, and so what about, across the country?
There's about 45,000 so far that have been placed since it was approved in 2012.
What kind of results can a patient expect when they have this procedure? Sure.
So about 85% of them will be completely off their medications about a year after the procedure, and 99% will no longer have regurgitation, in the sense where food is coming up into their esophagus.
That's great to hear. Well, Dr. Hartman, thanks so much for taking the time to talk to us today.
Thanks for having me.
All right, this was your Genesis Medical Moments, and for more information, go to ourquadcities.com and click on the medical tab.